Hi, I'm Femi OK, and you're in the stream. Today, homeopathy. Some scientists say it's nonsense, so why do millions swear by it for good health? So we asked our online community what they thought about homeopathy. What do you think about homeopathy? There's a way for you to join in this conversation. Malika Bilal, what did you discover?
Well, we asked in particular what comes to mind when they hear that term, and we got responses from all over the world. And I'm going to share a taste of two that show the polarizing ends that this debate falls on within our community. This first one is out of India. This person tells us it's the medical system of the future. But moving over to Malaysia, we got a slightly different answer. This is someone who says it's quackery, but some swear it cured them. So we want to hear from you, whichever side of the debate you fall on. You can tweet us your thoughts with hashtag AJStream.
My name is Dr. Sumit Gupta. I'm a childhood cancer doctor at the Hospital for Sick Children in Toronto, Canada, and I'm in the stream.
Homeopathy is an alternative medicine system that's become a multi-billion-dollar industry around the world. A German physician came up with it back in 1796, and since then it's gone mainstream in India and has schools and pharmacies dedicated to it around the globe. Yet controversy over homeopathy is strong, so much so that regulators in the US and the UK are looking into it. So what are the ethics of prescribing a treatment that's still fiercely debated? With us to talk about this in London, we have Dr. Peter Fisher. He's a homeopathic specialist, hello there, and Director of Research at the Royal London Hospital for Integrated Medicine. Also in London, David Cahoon is a Professor of Pharmacology at University College in London. Hello, Professor. In Boston, Massachusetts, hello. Dr. Michelle Dossett is a researcher at the Benson Henry Institute for Mind, Body and Medicine. And in Mountain View, California, Dan Ariely is a behavioral economist and professor of psychology at Duke University. Good to have you here, everybody. Okay, a rapid fire round. Peter, if I asked you to explain to us what homeopathy is, just in a nutshell, what would you say? I'm going to ask all the guests this. I just want to hear how you think about it.
Well, we have a little slogan, similia similibus curenta, let like be cured by like. It's the idea of giving small doses of substances to stimulate the body. It's not the primary effect of the drug, but the rebound effect, what we call the secondary effect that you're looking for the curative action.
David, what is homeopathy?
Homeopathy has been known to be impossible bunk since 1865. It is consists of giving pills which contain no medicine whatsoever and therefore have no effect. It is the simplest of all forms of quackery to debunk because there's no medicine in it.
Michelle?
It's a system of complementary and integrative medicine that began in Germany but is spread around the world and is unique in that it has a whole philosophy and theory associated with it.
Dan?
I think that it is the ultimate placebo. And one of the benefits of having the ultimate placebo is that it has no downside effects to taking it.
Peter, this is problematic.
It has no downside effect as long as the patient isn't really ill. The downside effect is when people start taking it to prevent malaria, for example. Then it's lethal.
That's right. You're absolutely right. So the taking it is not as long as it's not a substitute for anything else, it has no side effects, is really what I wanted to say. But that's right. If people substitute other forms of medicine for this one, that's a place where we should be extra worried.
Yeah, unfortunately, this discussion entirely ignores the evidence. There are a large body of placebo-controlled studies. You can very easily access them. There's a database called COREHOM, that's CORE-HOM. You'll find it very easily if you enter that into Google, which has a database of all clinical trials of homeopathy. There are over 1,000, of which some 400 are placebo-controlled studies. You can search it very easily. It simply isn't true that that's what the evidence suggests. There are also animal studies as another linked database, also run by the same organization which looks at animal and in vitro studies. Unfortunately, we're debating this in a vacuum of evidence.
Peter, before you get too much further into that, especially with the placebo-controlled studies that I know we're going to talk about because lots of people online are bringing them up, I think we have to start even a little bit more basic because this is a comment we got via Facebook from Stephen. And he says, Stefan, excuse me, he says the problem is many people do not understand the concept between natural medicine, quote unquote, and homeopathy. To them, homeopathy is something like chamomile tea. So you gave a really short and sweet explanation, but can you tell us the difference and maybe what some people might have as misconceptions?
Well, that is true. Chamomile tea is a herbal medicine. Homeopathy uses herbs, but also a wide range of substances, including highly toxic substances, arsenic, for instance, in small doses. On the eye, so it doesn't have to be plants,
doses, Peter.
and it
Zero
is not
doses.
just the
Please be
empirical use of
accurate.
plants. It is based on the idea of a rebound effect. You stimulate the body.
So,
Peter,
Peter,
Peter, please be accurate. It is not a small dose, it's a zero dose.
Actually, if you look at some of the
Submolecular
OTC
dosage.
combination products that are available in the States and many other countries, they do contain measurable amounts of molecules in them. Things that are 4C or 6C potency.
The majority do.
They may
Not all
actually
of them
have
do.
effects.
It's true that some of them are the molecules are diluted out, but actually the majority.
And the theory is that the more you dilute it, the more potent it is.
all right, so let's take this diluting issue, because I think that's where sometimes people are a little bit confused by the science of it. So Peter, I came to you and I was stressed. I have a very stressful job. What might you, particularly right now?
Yeah, I have a nice little line.
Yeah.
Women particularly.
What might you prescribe for me that might be along the line of homeopathy remedies? And then explain to me what was in it.
Okay. So first of all, I would take a detailed history. We look at the whole thing. I mean, what kind of stress, what kind of person has the stress, what are the manifestations of the stress, what other problems do you have? Do you also have migraine or skin trouble or asthma?
Yeah.
So very important to look at the whole person.
Right, so I've got a little bit of, my shoulders go up, a little bit of stress in the back.
A substance which potentially could cause symptoms similar to those which are suffering.
All right, so I know you've got a little bit
what
of...
potency would you use?
I know you've got a little bit of show and tell, because this dilution of what you might prescribe, that's what people get quite annoyed about. Can you explain that for us? Michelle, you explain that to us, the dilution part of homeopathic remedies.
So let's say I was going to make a 30C potency. I would start with a tincture, if it was a plant, and take 1 part of that tincture and mix it with 99 parts of an alcohol and water solution. And then it's succussed or shaken up and down very violently in the container. And then 1 part of that is taken and mixed with another 99 parts of alcohol and water solution and shaken. And that's done sequentially 30 times. Important to understand, it's not just simple dilution, but it's dilution with these intermittent succussions in between. And there actually seems to be some difference in the biology.
Can I explain to the listener that if you do that, you end up with 1 molecule in a pill which has a diameter equal to the distance from the sun to the earth. If it's labeled Arnica 30C, it contains no arnica. It's just mislabeled and it's fraud.
I'm curious, David, how you would explain the nanoparticle research that's come out.
I'm curious, Michelle, if you could just...
It's complete nonsense.
Oh, okay, that's a first. I'm curious, Michelle, if you could just unpack that for the rest of us who aren't following the research on this.
So,
what did you just bring up?
you know, as you might gather from what David has said, and this is what we thought for years, there could be theoretically no molecules of the original substance present.
Right.
And in the last few years, there have been several studies where they've taken some of these very highly diluted substances and shown that there are actually molecules of the original source ingredients present in them.
Can I explain how this misapprehension arose? Hahnemann was actually not a silly man. He was actually quite sensible. He was interested in chemistry. There was no medicine at the time. But he was sensible enough to realize that if you gave 50 grams of antimony to a person, it was going to kill them. So he reduced the dose. And he went on reducing the dose. And he reduced it, in fact, to a point where there was nothing left. And he was aware that this process couldn't go on forever. He said it in a couple of places in his writings. The trouble was he had no means of knowing when there was none left. He died in 1843, and it wasn't known until 1865 how much dilution you could make and leave nothing behind. Of course, it appeared to him to work because the medicine at the beginning of the 19th century, the end of the 18th century, killed people on a wholesale scale. So by doing nothing, which is what he was inadvertently doing, he didn't kill so many people, and it looked rather good. But if he had been around now, he would have just laughed at 30C dilutions, because he would have known, and he was perfectly sensible enough to realize, that they contain nothing.
So when we talk about these pills being diluted, Dan, I actually want to bring you in here, and I hear you trying to get in. So we talk about this dilution. That's where our community comes into. This is what James says. He says, look, what these things are sugar pills. There's no perceptible active ingredient, so it's a faith-based medicine. And he goes on to say, the truth is that the effects of illness are created by our brains as voluntary actions. So believing strongly can change them. The problem is that not everything is just symptomatic. Cancer doesn't stop being cancer with a change of attitude. So clearly that brings up the placebo effect in this. Dan, what are your thoughts on that?
Yeah, so I'm a big fan of the placebo effect. So I've been doing all kinds of research on the placebo effect, and I give people pills that I know have nothing in them. I just don't tell them that. And I tell them different things about those pills. So for example, in one experiment, I told some people that these were expensive pills made in China. I told other people these were cheap pills made in China. Other people I told these were expensive pills made in the US. Other people I said this was cheap pills made in the US. And then I connected them to a device that gave them electrical shocks. And the question was, how many electrical shocks could they sustain? And you know, the expensive medications work much better. Now it's a placebo medication, so it has nothing to do with pain, but beliefs do seem to change our physiology. And you know, it's really rather obvious, right? If you think that you're going to have dinner and you anticipate the dinner, your biology is going to prepare itself for a good dinner. If you're going to have a nice evening with your significant other, you anticipate it, you think about it, you prepare for it, your physiology changes. Now these changes are very deep. So in another study, we gave people an energy drink. This was like one of these caffeine-enhanced drinks. And we told people some that they were full price, some people we told them they were on a deep discount. And then we gave them different tasks, including IQ-like tasks, problem-solving tasks. They have to solve math problems. And the people who thought the drink was more expensive actually solved more problems. Now, for me, this is the magic of placebo. And the fact is that there's lots of things in medicine we don't understand. The body has an amazing ability to heal itself.
That is very interesting, but from everything we know about placebo, I think you would agree that little white, insignificant, and cheap pills, this is a homeopathic pill, little tiny white pill, tastes nice, made of sucrose, actually, the pill itself.
Peter, hold it up higher.
I think homeopathy is a wonderful placebo. I think that one of the things that is really important about placebo is to have a theory that people would believe. You know, if you give people a medication and you just say, hey, this is placebo, take it, I think the belief is not there. I think what is so nice about homeopathy is that the theory behind it does have some natural appeal. You say, oh, you know, just like in snake bites, the same thing that causes the disease could help it. The same things about vaccination. This is the same thing. We're just going to dilute it. I think the theory is very appealing on an intuitive level. And if I had to come with a placebo, look, if my job was to come up with the best wonderful placebo to convince people that this is good, it would be about high price. I would add a really nice bottle. I think I would make it in a capsule, not in a pill, because that convinces people more. If I could do injections, I would do injections. But also I would have a theory about why this is such a nice thing and why people should believe in that. And if people believed in that, it would sustain itself over a long time.
All right, Dan, let me just get Michelle into the conversation here. Go ahead, Michelle.
Say that all of what he's saying is, all of what Dan's saying is true. And the other thing that's really important here is the patient-provider interaction. We know from the research too that has a huge impact on affects patients' responses to treatments. My group did a study that was published just a little while ago where we took people with gastroesophageal reflux disease, and they were randomized to receive either a, quote, natural supplement that was targeted for their heartburn symptoms or a placebo, and we simultaneously, without them being aware of it, randomized them to a high-quality conventional medical visit or to what we called an expanded medical visit that was more like an integrative medicine consultation, where the amount of time that was spent with the patient was longer, more detailed questions about their symptoms were asked, and it was the patients in that latter group that had the greatest improvement in their GERD symptoms. And so realizing too that just the context in which the therapeutic encounter occurs has a huge impact on patients' responses to treatment.
Michelle, I'm glad you raised that, because that's actually that is something our community raised, but it was a reason to give homeopathic remedies. This is Betty on Facebook. She says, as a medical doctor, I am continually astounded at what these remedies can accomplish. Homeopathy is labor intensive and a labor of love, but the reward is observing the deep healing that you don't achieve in a 5-minute, here's your antibiotic visit. On the other hand, though, on that other side, this is Matt, and he says, in the UK, we have a responsibility to be honest with our patients about the evidence underpinning treatments, and there is none for homeo. David?
By the way, I think both of those are important questions. So what Michelle is really bringing, I think, is something very damning to the medical profession. And I think the problem is that most of medicine is treating individuals as passive receptacles of medications. The body has an amazing feedback loops and different approaches. Look, if you went to a car mechanic and there was 30% chance the car will fix itself, you would think mechanics are geniuses. The fact is, you go to the doctor, many times it's not a doctor, it's the body that fixes itself.
I love that. I love that analogy, but it's very rare does a car actually fix itself, but the human body sometimes
I know, this is why we have this magic in medicine. But the fact that in many cases, look, I was badly burned. I was in hospital for over 3 years. I was burned 30 years ago. I still had surgery last year. The fact that the medical profession in general, not everybody, treats people as, like plants, right? We'll just water them and they'll grow and they'll get fixed. I think is a terrible idea, because they're not really treating the psychology of
Peter
people.
is really keen to actually have this conversation with you. Peter, go ahead, and David, I'll come back to you. Peter, go ahead.
I think it's important to get the terminology right here. There's non-specific effects, the non-specific effects of treatment, that is to say, everything really, except the effect of the pills or the medication that you administer. So that includes listening sympathetically, the patient feeling understood, good advice on exercise and lifestyle, explanation of what the problem is. All that is non-specific effects of medical treatment. It is very important and absolutely vital. The medication should be the icing on the cake. Placebo effect is something different. Placebo effect is essentially a conditioned reflex, a Pavlov's dog reflex, whereby expectation which may be from previous experience, which may be cultural, leads to people to feel better and indeed to be better. So let's be clear.
By the way, you
absolutely, I have no shame. Indeed, I'm proud of maximizing the non-specific effect of my treatment, but I wouldn't practice homeopathy for 5 minutes if I thought it was just a placebo. And as I pointed out, if it was a placebo, we would have in 200 years come up with a more impressive placebo than little white pills, which are quite cheap.
All right, so guests, just give me a moment, because David had been waiting very patiently. David, what did you want to add to this conversation? Go ahead.
I want to explain why all this stuff that we heard about placebo effect is irrelevant to the conversation. The sort of placebo effect, they're quite interesting effects in the experiments that were described. The fact is, they don't hold up in the clinic. They are completely artificial things. If you want to do to measure the placebo effect, what you have to do is to compare the treatment with no treatment, not with a placebo. And when you do that, you find that the placebo effects are quite small. They're there, but they're sometimes there, they're sometimes not. But they're small. They're not big enough to benefit the patients to any noticeable extent. I'm sure that must be aware of the Nordic Cochrane collaboration paper on these things.
He may be, but I'm not. Why is that relevant? David, why is that relevant?
It's relevant because it's not the placebo effect mostly that makes people feel better when they take a pill which contains nothing.
All right.
What
I hear the point you're making.
effect-
We're rapidly running out of time, and we've got a little bit more time in our after show. So hold tight on that thought for a moment. Malika, where do you want to take us next?
Well, there is this thought from Kelly, who sent this on Twitter and saying, I have a friend who was treated for MS by homeopathy. The doctor is amazed, yet refuses to research for his patient, says there's no money for him. So this is one anecdotal evidence for it working. But what I wanted to focus on is that money. Is there enough money to research whether or not it works? And I'll pass that on to you, Dan.
I don't really think that there's enough money to get people to do it, because medical companies, pharmaceuticals are certainly not going to go into this. I think academics, most people don't believe in it, and they're not going to do research that kind of they think the conclusion is foregone. So I don't see good research coming up on this. I mean, there might be, but I don't see a lot coming up.
The biggest homeopathy company in the world, Boiron, makes 300 million euros turnover.
But they don't want to do
it's
research.
A huge company could easily afford to do research. It doesn't do it because
we're talking about interest.
Fail.
Michelle, what were you trying to say?
I would say
Michelle.
the biggest problem in terms of academics wanting to do research in this area is the automatic bias that exists within the scientific community, and the difficulty in getting grants funded, even grants that are very well designed. And that's why many of the studies in this field are small pilot studies, because there just isn't the funding for the larger ones.
See, I guess I feel that this must be deeply frustrating for you, David, and also for you, Peter. Peter, you know that this works. David, you also know it doesn't work. Where are we going to get to in terms of, we're 200 years on. Peter, when will this be sorted? Finally done, no more debate.
It doesn't look like any time soon.
No.
But, first of all, we need to look
It is
at the
almost
evidence.
sorted.
Hold tight, David.
It is
so I can
quite
hear
easy
Peter.
to look at the evidence.
Right.
As I pointed out, there is a database, you can look it up. Actually, most of the people who've looked at the evidence have concluded that on balance it is positive, particularly in areas like allergy and hay fever. And yet you continue, I was told, there is no evidence, there is no evidence. We've had that this evening. It is simply not true. There is evidence, and you can access it online.
You just don't understand the statistics, I'm afraid, Peter. But no, the reason people won't, you can't call it bias to say that a pill which contains nothing has no effect. It's just common sense. That's not bias, for heaven's sake.
Well, how do you explain that you take a set of data and you write it up into a paper? One paper contains homeopathy as part of the language that it's in. The other paper does not contain the word homeopathy. Same data sent out to multiple journals for review, and the paper that contains the word homeopathy is systematically rejected by multiple journals for publication, whereas the other paper is accepted.
Oh, that's an interesting study. Wow.
This study has been done.
Right, fascinating.
That's a different thing.
All right, so guys, everyone just hold tight for a moment. I just want to see where online community are, because you've made some very persuasive arguments. I'm wondering how persuaded they are. Malika?
I think it's fair to say the community is just as divided as it was when we started the show. So this is how we'll end it, with ordinary guy who says there's tons of evidence about homeopathy. It's not working. It's just a placebo, period. On the other side of that debate, Larry says all forms of medicine have placebo components. Homeopathy works above and beyond the placebo effect.
We're taking our guests to the post show at stream.outerzero.com. The debate will continue there. Hopefully you can join us. Thanks for watching, everybody. Take care. Hello, this is the Streams Online Post Show. We're talking about the controversy around homeopathy. I feel like we've just done a mental workout together, a little bit of extra time here. Malika, what are people talking about?
Well, earlier, right before we headed into the post show, we talked about some of the best case scenarios, the friend who was treated for MS. This is a question about some of the worst case scenarios. This is Simon, who says, a placebo won't help if you have a serious condition, and the result of fake/non-treatment, this person's words, can be death. Another person, this is Matt, saying, I've seen patients who've needed effective treatment urgently opt for homeopathy and run the risk of severe complications. So David, I know you mentioned a little bit earlier some of the dangers as you see them. What are they?
The dangers of being treated for malaria with a pill that contains nothing. The danger is that you die, of course. And there's completely irresponsible things. There was a meningitis vaccine, so-called, being sold, which contained nothing whatsoever. That's just homicide. And in fact, in Australia, 2 homeopaths were jailed for manslaughter because their own daughter died when they insisted on treating her homeopathically. A lot more homeopaths should be charged with manslaughter, in my view.
So David, are we not just talking here about bad practice? And you can find that
This is
across,
bad practice.
yeah,
And
that's
the
bad
evidence,
practice.
The evidence shows quite the opposite, in fact. When we have there's a large-scale clinical trial done in France called EPI3, over 6,000 patients, where they just looked at what happened to patients who went to conventional GPs and who went to GPs who also use homeopathy. And this is quite easy to do in France because large numbers of GPs do use it. And what you find across the board, in the case of musculoskeletal disease, they use less non-steroidal anti-inflammatory drugs, a very dangerous class of drugs, half the number, in fact. Similarly, for sleeping problems, the homeopathic doctors used half the number of hypnotics of sleeping tablets, and in both cases had the similar results. So actually,
I can quite believe that. I'm all in favor of not
homeopathy
using
does
non-steroidal
reduce
inflammatories.
the use of dangerous drugs. And that is what the evidence says. This is a over 6,000 patient study that says that.
But that doesn't say that it helped the patients. What it means is that the conventional treatment doesn't work very well either. That's all it means.
So
I'm all in favor of you.
So here's where
Well, that may be the case, but it was safer.
let me throw this out to you guys. Here's where there might be some harm. If you're having this debate, for instance, let me just show you something here. I'm sure you're familiar with this. There's a report in Australia saying homeopathy was effective in treating any condition. And then there are universities who are deciding to take it off as a university course. And if it's a field of medicine that maybe just needs more research, more stats, but it will help some people, isn't that the danger that we're not practicing medicine that may well help people? Not that there may be some very tragic cases where people are being treated with malaria and they get malaria and then they die, but actually there may be millions of people who may benefit from this. But while the medical profession is like having this feisty debate, people may be put off. Michelle, I see you nodding there.
Actually, you know, the medical profession isn't having a feisty debate. There's a handful of people like Peter Fisher who still believe in it, but there's no debate among scientists. It's obvious nonsense and has been recognized as such for many years. In 1960, it was almost dead. You know, it had essentially vanished in the 1960s. It's sort of 70s,
a real
80s
resurgence in
when
the last 40
New Age
years.
thinking became fashionable. That it suddenly had a little resurgence, but there's no debate about it. Everyone knows it's nonsense.
David, I think there are people online that would disagree with you. I'm going to read you 2 tweets. This is from a dentist. This is
sure
Samantha, of course. Samantha says, it works well in the right circumstances. It also works well alongside conventional treatment. And she went on to say the successes in her own life. She writes, I've had success with anxiety, cold sores, mouth ulcers, burning sensations in the mouth, and infections. So Peter, what are some of your success stories?
Well, personally, I'm a rheumatologist. I can practice conventional rheumatology, and at times in my career I have earned my living doing that. And there are, of course, some highly effective drugs. Highly effective, but they can also be very dangerous. So I treat a lot of arthritis, fibromyalgia, soft tissue. That is my main, stock in trade. And we are fully integrated in the National Health Service. We receive referrals from GPs. You can't come straight to me. You have to be sent by your GP.
And
You know,
the fun
Our
I think
hospital
that one
treats
of
many
the-
things,
on the
including
one
a lot
of the
children's
big
disease.
Let me just bring
by 95%.
David, hold tight for a moment because I want to give Dan a bit more time. Dan, I know you were trying to break through there. Go ahead.
Okay. Yeah, actually, the discussion is great, but I think there are kind of two different types of discussion that we're having. We're having a discussion about science, and we have a discussion about practice. And medicine does a little bit of both. And David is a scientist, and look, this is a scientifically very unsatisfying compound. When you say we have a submolecular level of something, how could it possibly interfere? And as a scientist, it's just offensive. It's just offensive to say, we don't have a mechanism.
No, what is offensive is to ignore the evidence, because there is evidence.
Can I just finish the sentence?
You simply don't know it.
I think
That's
on the
what is
other hand,
offensive.
we have the evidence that show that you give it to people in placebo-like trials, and people have benefits. And this is without a mechanism. We don't say we understand how it works.
Does it
We just
matter?
say, look, you
Does
give it
it
to people
actually
and
even
something.
matter?
I'll tell you how
And
it
something
works.
happens.
What does it matter if you're a patient and you're being treated and you get better?
I think it does matter.
Why does it matter?
It matters.
I'll
It
tell you how
matters
it
first of
works.
all for where we're going to move forward. So if this is indeed a good placebo, we could say let's make it a better placebo. And how would we develop that? Then of course there's ethical,
I'm sorry, I must insist. What is offensive to science here is ignoring that, is not talking about pontificating on the evidence and not knowing it. There is evidence from
science,
research, from
science-like
in vitro research,
mechanisms,
which indicates these.
mechanisms
You
and
are
not just
unfortunately
results.
unaware of it, and that is not very helpful.
I know the evidence, Peter, very well. I've been reading it for years. It is poor quality nonsense. And
I think the real question is mechanism. So Peter, are you satisfied that you understand what is the mechanism that homeopathy works by? What happens in the body? You're not satisfied, right?
No,
and
I
that's
don't
what I'm
understand.
saying.
But on the other hand, if we never used a drug in medicine whose mechanism of action we understood at the time it was introduced, we would use very few
I'm talking
drugs.
about science. I'm not talking about medicine. I'm saying from a scientific perspective, when you say this works, I have no idea how, and don't ask me why. It's a scientifically very
I didn't say I have no
unsatisfying.
idea how it works. I didn't say that. I said I don't have a full understanding. That's the question. Certainly I don't have a full understanding. To say I have no idea is not the case.
Okay. So I think it's scientifically we're very unhappy, and I think that for me the real question is what are we going to do? Is somebody going to find out the mechanism for doing it? That the same thing happens with acupuncture. That the mechanism that people believe in acupuncture almost certainly is not true. But you poke people in different places, and they report to feeling better. What do we do with this?
I entirely agree with that.
So,
and
I can explain that very well.
People had a hook to hang their hat on. They said, well, this is a plausible mechanism, therefore we can believe in acupuncture. Subsequently, it turns out that it may be plausible, but it isn't true.
Dan, are there any alternative medicine practices that you actually feel that works?
Oh, look, I love placebo.
Because that's what
I love placebo.
No. Moving on from placebo, because I
sometimes
feel like you placeboed me to death, okay? So placebo, I hear what you're saying about placebo. Anything else? Are you saying all alternative medicine works on a placebo?
Yes,
What?
and it's great. I love placebo. It's amazing. It's the human power to
That's
heal
huge.
itself. It's an unbelievable power.
It actually
Meditation,
is not true, I'm sorry.
yoga,
Fantastic.
herbal teas.
Meditation can have an effect.
That's all
Yoga can have
placebo?
an effect.
Wow.
By the way,
Simply
some of
it's
those,
the placebos
some
are
of those
wonderful.
There's
meditation,
very
I
good
think we're
data
starting to
that
understand the
meditation
mechanism. So meditation, I
has
wouldn't put as
certain
a
underlying
placebo.
physiologic changes that are associated
Wow,
with it.
Dan,
We've
that's
documented that with
huge.
MRI scans. We've documented
That's
that
right.
with changes in gene expression in cells of the immune system. There are a number of physiologic changes that occur with meditation practice and with other mind-body practices like
That's
yoga
right.
and
I was
it
agreeing with you.
works.
Absolutely, and the results on meditations are really incredible in terms of reframing
Right.
how people think. So
I'm mixing
spoke
up
quick.
different practices here. I was just curious to Dan as to what you actually felt did work and why, and where that spectrum was.
A lot of surgery works through placebo effect. You know, they did this interesting study.
You can have
where
placebo
where
surgery.
they cut people's knees, but
These
didn't
people are
actually put
talking
the instrument in. It
Yeah.
worked just as well as when you put the instrument in.
That's amazing.
So there are, you know,
That's extraordinary.
Placebo effects happen very strong in surgery.
Okay, so let me just ask.
I seem to
ask you all one by one, because this could go on for the next 200 years, and we don't have that much time. All right. So, Peter, this must be exhausting. Not only are you really high up, very well respected, really well known in your field, but you're having to debate this constantly. Where do you think this might go in the next 5 years? Do you feel that you're winning this debate?
Yes, I do. I think, you know, actually, if we can focus on the evidence, and if we can stop having these sweeping statements, it's impossible, it can't possibly work, there is no evidence, which are simply not true. We need to focus on the evidence, then we can make some progress. And I'm not telling you the evidence is conclusive or perfect. I'm telling you there is evidence and it deserves to be debated.
David, are you winning in the debate?
Of course we are. Peter Fisher knows full well that the funding for homeopathy on the National Health Service has fallen by 95%. It's almost gone. There's a hospital which he works at called the Royal London Homeopathic Hospital, well, it's changed its name with a bit of public relations, which is now reduced to one small floor. It's only a small part of that hospital. Of course it's losing, and that's good, in my view, because it is fraud.
I feel like we ended where we started. So it's good to know no one has changed their mind
We're a little older now.
Yes, a little older, a little grayer. Meanwhile, I've really enjoyed this. I feel like I've had a mental workout. Thank you, everybody, for being part of this conversation. Malika, what do you have?
Lots of things to think
Actually,
about.
can I say one positive thing to
That would be good.
sum this?
Yeah. Let's hear that one positive thing.
I think that the real issue is what is the side of the patient in the practice of medicine, and you know, forget the specific of homeopathy. It's really about getting the beliefs and interest and care and motivation of the patient into the medical profession. And I'm not sure how exactly we'll get patients to be more active in this, but to the extent that we could do that, I think we'll be better off.
Interesting.
Absolutely.
All right, now.
And ultimately,
I'd
patients
like
want
to
to be
find a
better.
word on that as well.
All right, okay. I feel like that is an area of an agreement for everybody. I'm just going to say that as a statement.
I'm sure David
and not
doesn't
ask
agree.
you. No, I'm not even going to ask him. Not even looking at you. Malika, what do you have?
Well, it's interesting. I was going to end with one pro and one anti-tweet, but because you said that, Dan, I do want to end with this comment we got from Karen Jensen from Harvard University, and she echoes what you said, and we're leaving it on a positive note. She says, it is clear from medical research that the interaction between a patient and a clinician or a doctor is a powerful contributor to treatment outcomes. So if we can focus on that, as Dan mentioned and Karen mentioned, that might be a good thing.
Dan and Michelle and David and Peter, it's been an invigorating show. Really enjoyed your company. Thank you very much. Take care, everybody.